Donc, on va commencer sans plus tarder. Bonsoir
All
à
right,
tous.
so we'll begin without any further delay. Welcome to all of you. Thank you for participating in this important discussion.
Merci à nos représentants
Thank you to our
de la
representatives, our counterparts,
d'avoir une meilleure compréhension
who will allow us to have a better understanding of the reality of women in El Salvador. You will see that their situation is at once unique but also common to many women around the world. We have two interpreters with us, Michael Carty, who will be doing the interpretation from English to Spanish and vice versa, and our other interpreter who will also be providing interpretation from French to Spanish. To activate the interpretation, please click on the icon in the shape of a globe, and you can choose your language of choice. Note that the main presentations will be in Spanish.
Locate the interpretation earth-shaped icon at the bottom of your screen, and you can then select your preferred language. Note that the main presentation will be in Spanish. À répéter por última vez, si necesitan interpretación.
One last time, if you need interpretation, just click on the icon in the shape of a globe and select the language of your choice. So we invite you now to join us in opening this forum. Feel free to introduce yourself and to ask questions in the chat box throughout. You can also ask any technical questions if you're having issues to Ashley in the chat box. She is here to help us. So let me begin by introducing myself. My name is Lisanne Léveillé. I'm a co-manager at Interpares. Interpares means between equals. It's our way of seeing solidarity, of understanding solidarity internationally for more than 40 years. We've been working closely with more than 100 organizations all over the world to build peace, promote social justice, and to globalize equality. We work with counterparts, and I am very fortunate to work with our counterparts in Mesoamerica, like the Colectiva Feminista, who is joining us this evening. I am joining you from the Anishinaabe lands, traditional territories today. We honor them as the first guardians and caretakers of this land, and we recognize their relationship over millennia with this territory, which is unceded. We salute their resistance and their resilience in a process of decolonizing these lands here and around the world. If you would like to tell us what traditional territories, what indigenous territories you are joining us from, by all means do so in the chat box. After the introduction, there will be two presentations from the Colectiva, and then there will be a question and answer period at the end. Please note as well that the webinar is being recorded. And so we are putting front and center our counterpart in El Salvador that we've been working with for a number of years. La Colectiva works on a project to support sexual and reproductive health and rights in El Salvador and to promote a life free of violence for women. We thank Global Affairs Canada for their support in this initiative and project. They are going to talk about this project, but they're also going to go beyond that and talk about some underlying issues related to discrimination. They're going to talk to us also about how this past year has really accentuated, has increased the inequalities that many women face. And in this struggle for the rights of women in El Salvador, we're very glad to count on the support of the Canadian Embassy in El Salvador. And that's why we have with us this evening to greet us, Her Excellency Carolina Gay, currently Canada's ambassador in El Salvador, who is joining us and who will greet us with a few words of welcome. So over to you, Madame Gay. Thank you very much, Lisanne.
C'est un très grand plaisir d'être ici. Es un gran placer estar acá. Je vais faire mes commentaires ou mon introduction rapidement en français pour aussi rendre
I'm
la
going to
vie
do my comments in French to make things easier for the interpreters, but know that, of course, I speak all three languages and you can communicate with me, ask questions of me in any of those languages. So once again, a great pleasure to be with you this evening, even more so because we are in IDW, International Development Week, which was established in 1991, to raise awareness among the Canadian population around international issues and to strengthen the support for Canada's action on the world stage in the area of development. I started my work at CEDA, the former CEDA, inspired by these International Development Weeks. So it's a great honor for me to be here with you this evening. As Lisanne said, and as you all know, we look at the very difficult realities for women in El Salvador, particularly in the context of sexual and reproductive rights. This was already a very difficult situation before the pandemic and is the case for many women around the world. And many of you are familiar with this context. This theme then of access to sexual and reproductive services, healthcare, and also the defense of the rights of women and girls is a priority for Canada. You know, much of my work here in El Salvador is around this, working in this area, working with various parts of the El Salvadoran government, working in the UN system, and also working with a number of Salvadoran civil society organizations. So it's really great for me to be here this evening because it really is a priority for us at the embassy. I also wanted to mention that this work, this support for access to sexual and reproductive rights and services is very much anchored in the FIAP, which will be celebrating its 4th year very soon. This feminist international assistance policy is often misunderstood. And so to express it very simply, for us, we want to put the emphasis on women and girls, put them at the center of all our interventions, because we know that without doing that, there is no economic development, social development, or durable peace. So we need to focus on the needs of women and girls. And from there comes the importance of access to sexual and reproductive health and services. It's very important for us to support a number of partners who do this work to reduce the number of dangerous abortions, to offer opportunities for women and girls to fully achieve their potential and contribute to the societies where they live. As I said at the beginning, the situation is very difficult in El Salvador. I'm going to allow the representatives from the Colectiva to talk about this. Between 2015 and 2019, the UN Population Agency, which was one of our partners here in El Salvador, 98,000 girls and women who were pregnant had difficult access to services to help with their pregnancy. There was a lack of funding as well, more than $500 million that did not reach the people that it needed to reach. This is a very sensitive topic, and I think the Colectiva is much better placed to talk to you about it. We are in an electoral campaign right now in El Salvador. It's a very divisive issue. Abortion is completely illegal, no matter what the situation of the a girl or a woman, whether she's been raped, in danger, whatever. Abortion is completely illegal, and there are dozens and dozens of women who are imprisoned, who are sent to jail for trying to access abortion services or other services. So I wanted to recognize the important work of women's organizations like La Colectiva, with whom we have incredible solidarity and a number of projects together. This is courageous work that they're carrying out, and I would like to salute that work, honor them, and I'm glad that you're all here to hear them. So I'm going to stop now because we want their voices to be heard above all. Thank you to Interpares for inviting me this evening. Thank you to our public, all of those who are joining us. And I'm sure that many of you are very committed to these issues. And so without saying anything more, I hope that this will be a productive webinar. I wanted to say this in Spanish because I wanted to recognize the important work of the colleagues at Colectiva Feminista who are making an incredible contribution to Salvadoran society through their courageous work. Thank you very much, Madame Ambassador. We can see that you are an ally in this work, so we really appreciate your support. Before beginning, we would like to know whether people have any links or connections to El Salvador. So a quick survey that will appear on your screen. It's trilingual, and you can see it there. What is your connection to El Salvador? We ask you to select one or several answers. What are your links to? What is your connection to El Salvador? Have you ever traveled there for tourism? Have you ever lived in El Salvador? Perhaps you have family or friends in El Salvador. Perhaps your work centers around the country. Or perhaps it's all new for you. Perhaps you don't know anything about El Salvador, and so you're here to learn. So please answer. And there are the results. Very interesting. 62% are saying it's all new. That's great. That answers my question and will also help me to lay the table and to give us some context as we begin this evening. So a brief introduction, some brief background information before handing the mic over to our colleagues from the Colectiva. As Madame Gay said, she helped set the table already with some of her comments. There's varying degrees of knowledge about El Salvador, so I wanted to give you some of the context. What is the reality with regards to this work on the ground in El Salvador, the work that La Colectiva is doing? El Salvador is a country where there are many obstacles faced by those fighting for women's rights. The level of violence is very high. 1 in every 2 women has been a victim of violence at some point. Madame Gay mentioned the criminalization of abortion, which is one kind of violence, the negating of women's access to basic health care, the rate of feminicide in the country, the murdering of women by their partner or others. There are more women dying of feminicide than of COVID in El Salvador. 200 to 300 women a year in a country with a population of 5 to 6 million people. So the Colectiva is working in this context where it's even hard to raise one's voice against these inequalities. There are a lot of physical, psychological, and virtual attacks on the defenders of human rights and the rights of women. The current government and the current political context makes things even more complex. The government is delegitimizing the voices of women and those who are working with groups like the Colectiva. The Colectiva, who are they? They are a collective of feminist activists created in 2005. The teams are present not only in the capital city, but throughout the country in rural and urban settings, in 90 different communities. So that's a third of all the municipalities in the country where they are active and present. When we talk about gender-based violence. They are very much working on this in this area, but they are also working on economic development and inclusion for women, on defense of human rights, on environmental justice, on democratic governance and feminist governance, and the promotion of citizen participation. The information that will be shared with you this evening come from a survey that was carried out in April 2020, a month after the lockdown in El Salvador, where 969 people, adults of different ages, and 91% of the respondents were women. This investigation confirmed a number of things. They asked questions, different kinds of questions, some relating to economics. 67% said that they had no income whatsoever during the lockdown, which has greatly exacerbated the situation in a country where many, many women live below the poverty line. They also asked questions around care and health services provided. And 31% of respondents affirmed that they were the only ones taking care of children, doing the cooking and cleaning in the household, other domestic work, and also caring as caregivers in a healthcare context for family members. So this a disproportionate amount of responsibility placed on women, of course, has an effect when it comes to accessing justice, education, health, and so on. In terms of health, the investigation showed the precarity of public institutions in the healthcare sector and how this precarity has an effect on the health of women during the pandemic. A great number of the women who answered the survey said that they have chronic diseases and are not able to access the healthcare that they need. The collective has adapted its activities to the current context. For example, there are phone lines, helplines that have been created throughout the country to offer psychological and legal support to women. There have also been awareness raising campaigns around the increase in domestic violence and gender-based violence throughout the pandemic. So that's a brief introduction. Now I would like to hand things over to Marta Alicia, who is an activist and defender of women's rights. She is the coordinator of health and sexual and reproductive rights, and also municipal issues. She has been a municipal councillor in the past, and so without any further delay, Marta Alicia, go ahead.
Muy buenas tardes.
Good evening. Warm greeting to everyone who is accompanying us, who's joining us this evening for this conversation. For us as a feminist collective, it's a pleasure to be able to share with you our priority thematic areas, and especially the situation of women in El Salvador, the challenges being faced currently, the challenges that we are facing as a collective. How do we react as women's organizations in El Salvador to the current crisis? And we are going to share then this evening what we have experienced, what we've lived through, but also how we've been able to react successfully faced with this health crisis. Next slide, please. Our country is a small country geographically in Central America. The population is of 6.5 million people, 21,000 square kilometers. So a very densely populated, a small country. And this leads to some complicated situations, particularly in the context of the lockdown and of confinement and quarantine that's been taking place over the last few months. Next slide, please. Historically, our country has lagged in the area of recognizing the sexual rights and reproductive rights. And this has been an ongoing challenge for feminist organizations, for women's organizations, who only through fighting fiercely have been able to put these issues on the public agenda. And of course, this last year of 2020 has shown just how fragile access to these services, access to sexual health and reproductive health services is. The health system, of course, has been at the center of the pandemic, but it has been oriented almost entirely towards dealing with COVID. And that has had a huge impact for those who are trying to access the healthcare system for other reasons, including many women who are trying to access it for reproductive and sexual health needs. And so faced with these different situations, as is the case, for example, with access to programs for young girls, for adolescents, in the area of sexual and reproductive health. Many of those programs were completely dismantled or put on pause during the pandemic. Those who most suffered from these consequences were adolescent women. We'll go to the next slide now, where we have a graphic showing some of the results of a study carried out by the Association of Gynecologists and Obstetricians in the country. It's a very complex situation. We see here on this slide that many of the cases, 46.5% who said yes when they were asked, do you need or was it necessary for you to have access to contraception methods? 46.5% were young people. What happens in our country? Many women and young women, adolescent women, teenage girls need to use a contraception in a hidden way, so that their families, and even their partners don't know. And so this can be very dangerous for them, and this became even more complicated during the pandemic for these young women to have access to contraception. This increased the teenage pregnancy rate in the country. There are a number of think tanks, observatories who have been looking at this situation in the country, and we see that the pregnancy rate for teenage women has gone up. On the next slide, you can see the reality throughout the year 2020. What is the situation? 12,781 girls and adolescent women became pregnant in between January and December of 2020 in El Salvador. And this then increased at a national level to 22.29% of all pregnancies were teenage girls. This in part had to do with the lack of access to programs that had existed before the pandemic but had to be shut down during the pandemic. One of the complicated situations that we've seen and that has led to the following question: does this mean that young girls, teenage girls, were living with or have been in confinement with, in quarantine with their sexual partner, with their romantic partner? A lot of these women and girls were at home. And so we see that in the case of women and girls who have been the victims of violence through the pandemic, that means that the violence has taken place at home because people have been in lockdown. So their attacker is someone in the home. So these are very concerning numbers. Girls from 10 to 14 years of age who have become pregnant. Another issue is around the access to prenatal care and also postpartum care, which led a lot of women, uh, to find themselves in a COVID ward. Uh, the woman would say, I don't have any symptoms, I don't have COVID, but because of this situation, a lot of women suspect that they were sent to some places, some wards, some parts of the healthcare system where they then were infected with COVID. And then they were not able to go back to their homes, to their families, because they were now COVID positive. And so these are some of the very complicated situations that we've seen throughout the country. All of the cases of cancer, need for chemotherapy, many of them were delayed. Gender-based violence is of great concern, has been of great concern for many years, but especially during this past year of 2020. The rate of feminicide in the country is very high. You can see some stats on the slide. Women's organizations have been placed in a situation of absolute urgency, high alert. We needed to act in an urgent way to create conditions for women and girls by having helplines, phone lines where they could call for support, working very much with the state institutions to the degree that we could, with the municipalities, with other regional bodies. We had to adapt our programs to offer them virtually and to provide a follow-up. Schools had been closed. Girls and boys were not at school, were at home. And how could we put in place then services and programs that would prevent feminicide, which is, as you know, is a big problem in El Salvador. We saw even 12-year-old girls who had suffering great depression, great psychological scars because of sexual violence experienced in the home, and they were unaccompanied. There was no support for them. So these months and months of lockdown have been extremely cruel and difficult. You know, there was no transportation, there was no ability to leave the home. Mobility rights were very much affected. People could not access the healthcare system, let alone the justice system, and couldn't receive the support they needed. So the feminist organizations in the country had to carry out a number of actions to respond to this urgent situation. We had to train our members, our staff, and other folks within municipalities and other organizations to work in the area of prevention, both prevention of gender-based violence, but also prevention of, of COVID within the context of this pandemic. We also had to put in place programs to deal with the rising rate of teenage pregnancy. We were hearing from teenagers that their curriculum was not being adapted to their needs during the pandemic. A lot of them were experiencing emotional trauma, depression, other psychological difficulties, and so we are trying to work with them in their homes virtually. A whole bunch of situations then presented themselves in this year, and we've had to, respond to them. These increases in teenage pregnancies, in sexual violence, in gender-based violence. We've had to try to create spaces to raise awareness in the population and to fight for a greater political will from our government. You know that abortion is criminalized, is very much prohibited in El Salvador, and there have been great and very grave consequences. Women who have been severely injured trying to access abortion in an unsafe setting. And in these months and in this past year of the pandemic, there have been some critical situations for women. So this is a situation that women's organizations have had to work on in difficult situations, under difficult conditions, to accompany these efforts, publicizing emergency numbers, doing work on the ground in the communities, training professionals in the health system to allow women to access prenatal and postpartum services even during the pandemic. And in communities, we see the reflection of all of this. Many women are saying, I had not planned for this pregnancy. This was not planned. So what do I do now? 43% of pregnancies during the pandemic were not planned, according to this study that was carried out. Women were not planning to have a second or third child, particularly not during this year of pandemic. And so these restrictions around accessing sexual and reproductive health care, the private system is not accessible. It's too expensive. It's too costly. The pandemic, of course, has had great impacts on poverty, which has been going up in the country. Women who were depending on selling drinks on the corner in their community, women who were business owners, women who were running small businesses to support their income and to support their families. Many of these sources of income dried up, and we had to try to accompany women in this regard. Even access to Social Security and government programs. These were all situations we were seeing throughout. Many women experienced real challenges because they weren't receiving regular treatment, frequent treatment for their chronic diseases, chronic illnesses. They may have been receiving this kind of treatment before the pandemic, but then as surgeries and other treatments were delayed or postponed, we're talking about women with cardiovascular challenges, with kidney issues, with liver issues, and many others. And we had to face all of these situations with them. And so that's the context I wanted to give you about what's going on the ground in El Salvador. I will conclude here. If women don't make an effort faced with this lockdown, we are going to suffer the most. We have been suffering the most throughout the pandemic. We've seen that very clearly in the studies and the research we've done. We need to then deal with COVID. We need to stop the spread of COVID, but we also need to respond to the needs of girls and women in our country faced with this crisis, and also be in solidarity with those doing that work elsewhere in the world. Thank you very much. Thank you. Thank you, Marta Alicia.
Muy interesante.
Very interesting. If you have any questions already, please put those in the chat box. My brain is in overdrive after hearing all of that. I'm sure many of you feel the same, and there will be a time for some discussion at the end. So I would like to now hand things over to Alicia Sanchez, who is a journalist, a feminist, also has a degree in pedagogy. She's a specialist in human rights. She has a master's in political science. She worked as a journalist, an investigative journalist, and also was the communications director for a number of different social movements and social organizations. She currently is the member of the Colectiva Feminista, where she works as a consultant in public policy on gender, healthcare, and women victims of gender-based violence, and also in the area of sexual and reproductive rights and health. So without further delay, I will ask Ada to make her presentation, and then we will have some time for questions and answers. Good evening to all of you. It's a pleasure for me to be in this space with you. Thank you for giving us this forum to allow us to share the realities that we are experiencing in El Salvador through these days of the pandemic, especially in the context of an absence of a focus on women's issues, on gender issues, particularly on the part of the government. And the effects of the lockdown on women, particularly following a number of decrees from the executive branch of government. We only had a week to reorganize ourselves when some of these decrees came into effect, were issued. And so we carried out some very important research at the beginning of the pandemic, and I will show that some of that research to you. And you see here how COVID-19 has had a great effect on women, as there's been an unequal gender impact. So what has been the impact on women in El Salvador of COVID-19? We know that the state entities have not been responding to this situation, have not been focusing their policies on women's needs, the increase of gender-based violence. The 21st of March of 2020 was the date of the first decree of a quarantine by the executive branch. It was a mandatory quarantine for the entire population. Without having previously studied the situation in the country, the government imposed this absolute quarantine. No one could leave their homes, no one could go out on the street. And this created a very difficult situation for many people. There was an increased militarization on the streets to enforce the quarantine. And this first decree had no gender lens, had no gender approach or perspective in terms of what the consequences might be for women. So we carried out a survey with women throughout El Salvador, mostly over the phone and through virtual means. 969 women were interviewed over the phone to investigate what were the effects of this total lockdown in the country. And it confirmed what we had feared, and that is that the most serious impacts had been on women and adolescent girls as a consequence of this quarantine decreed by the executive branch, which forced women to stay at home. The only way for the executive according to them, to control COVID-19 was a complete lockdown, total isolation, and to have women at home at all times, knowing that every woman should be protected from violations of her human rights. We saw that there was a total lack of integrated policies within the country that had a gender lens. As part of this survey that was carried out, the research that was carried out, we looked at the various executive and legislative decrees and their consequences for women, particularly in two areas: access to sexual and reproductive health and access to justice. There were 87 decrees issued. We prioritized and looked more closely at 43 of them because of their nature. And we saw that a number of these decrees that we analyzed, they were the ones that had the greatest impact on women. We saw that as part of our investigation, part of our research, the only population that they mentioned with a gender lens, and even this group they mentioned in an unsatisfactory way, were pregnant women, senior women, women with degenerative illnesses or chronic illnesses, or HIV positive women, women with certain disabilities. But women who needed to leave their homes in emergencies would be arrested, or at least risk being detained. Often they were detained by various public order forces, police forces, the army, because they weren't supposed to be out of their homes. So this was a very difficult dynamic in the country. There was a complete marginalization, invisibilization of the role of the public bodies that are supposed to ensure equality in the country, including the ISDEMO, which is the Salvadoran Institute for the Development of Women. And this is an institution, a public institution, that is supposed to ensure equality for women, and it was completely sidelined in the response to COVID-19. And this deepened the risk faced by many women. The only organization that was really visible at any profile throughout the pandemic was CONA, which is a public body, a government body that looks at issues faced by children and adolescents. There was no gender lens then, no gender perspective or approach in the responses put in place to COVID. The terminology used in the decrees had no gender focus. And we know that the effects of COVID have been very gendered. Women have greater responsibilities in the home, have more responsibility for their children. Many of them work in the informal and precarious economy to support their families, and suddenly found themselves without that income, found themselves without that ability to leave the home to involve themselves in these economic activities. And so the total lockdown between March and July 2020 had very grave consequences. There was a complete restriction around mobility rights. No one could leave. And so when people needed to go to the police to lodge a complaint, to lay charges, they couldn't do so. In many cases, obviously, they couldn't leave the home because they couldn't leave their children alone. We saw then an increase in sexual violence and gender-based violence, and an inability for women to escape from it, to get out of the home, to lay charges, or to have access to justice. The Constitutional Chamber of our Supreme Court issued several rulings saying that a number of these decrees were unconstitutional because there was no access. There was a total violation of the access to health for the population, and a total restriction on transit, on access to mobility and moving around to access various services. Access to justice in the times of COVID in El Salvador was very complicated. We're talking about access to the police, access to various ombudsman offices. There was increased repression by a number of police bodies. There was reduced access for women to various bodies, tribunals. A number of tribunals were actually shut down because the staff got sick with COVID, which decreased access even more to justice for women. Many women in El Salvador don't have access to a computer, let alone Wi-Fi, to be able to, lodge complaints or be heard in a virtual fashion. And so this has had very grave consequences as well for women who were already suffering situations of violence from their partners or other people in their lives. This decree 593 of the 14th of March 2020 ordered the suspension of the access to the specialized tribunals that deal with cases of sexual and gender-based violence. There was no follow-up for various measures to defend and protect women. And without access to the judiciary, there were some real dramas that unfolded during this whole period when people were deprived of their freedom to move around. Many women were placed in great danger. There was a suspension, halting of all hearings and various court cases of the Institute of Access to Public Information, the capacity of to get any the ability to get any response from the national ombudsperson, the citizens protector, and various other state bodies. What was also very difficult, women who were trying to find support were very much faced with obstacles because of the total lockdown. You were supposed to always have a letter on your person if you went out, and if you didn't have that letter justifying why you were out of your home, you could be immediately detained or arrested on the spot. So we saw a diminution in the denunciations. This was clearly recorded in the stats of ISDEMU. You can see the decreases in denunciations and in complaints on the screen in the slide. 737 fewer cases. Feminicide during the quarantine. Well, we've seen that there were more feminicides, there were more murders of women than there were cases of COVID for women during the pandemic. We know that the situation of violence due to the activity of gangs in the country has been a problem for a long time, but in many ways it's been even worse during the quarantine and during COVID. Also, as has been mentioned by my colleague earlier, there's been an increase in teenage pregnancy. The stats around sexual violence of minors have also been alarming. Sexual violence, 6,000 girls between 10 and 19 have been recorded in the files of the Ministry of Health for pregnancies. And there was a campaign then launched for mask wearing, and it also aimed to raise awareness on the masks themselves around violence and inequality in the country for women. So those are the elements I wanted to share with you this evening. Thank you very much for your attention.
Excelente, muchas gracias, Ada. Y
thank you very much, Ada. Very powerful presentations, both of you, and really the information you shared, it was very complimentary. We have a good understanding now of the situation in the country on the ground. If you want to ask your questions in the chat box, by all means, go ahead. I know that we already have some there. I will start to ask them to our two counterparts. I'm going to ask them in Spanish to make them intelligible, understandable for our counterparts. So there were some questions in the chat box around what you said in your presentations. One of the questions is, what is the reality? What is the situation for trans women in El Salvador? Do you have any numbers, any stats, any anecdotes, any information about what the situation is for trans women in El Salvador?
Vale. Sí, la situación de
Yes, the situation for the LGBTI community, as we call it here, and specifically for trans women, they suffered through a number of very difficult situations. There were many months in 2020, in the first months especially, there were a number of deaths in that community related to the lockdown. And it's a situation, as Ala has said, that we saw it reflected in the results of the survey and the research. In terms of the lockdown, there was no taking into account of these very vulnerable groups and populations, and actually they were made more vulnerable and more precarious in the context of a health crisis. For trans people, we could say, even before the pandemic, there are incredible restrictions because in our country it's very complicated to be a trans person. For this population, there are many challenges and obstacles already, and then add on to that COVID-19, the lockdown, social and physical distancing and isolation. That has been one of our aims, is to say, let's not do social distancing, let's do physical distancing, because people should not be isolated, especially really vulnerable groups. This greatly disadvantaged, trans people. The whole LGBTI community, in fact, suffered quite a lot in many regards, in terms of access to healthcare, education, and access to justice. So all of this was seen under the lockdown, and the responses, the political responses, the policy responses had no gender lens, had no LGBTI lens. We don't know very much about the health system in El Salvador, says one person in the chat box. Is it a private system? Is it a public system? Is it a blended or hybrid system? In our country, there is a public system which has a whole hospital network with many difficulties and weaknesses and lack of resources. From 2012 on, there was a new health reform introduced, and there were community health clinics and community health spaces created throughout the country, but these are spaces and facilities that are not accessible everywhere in the country. Some of them, for example, in Clocatlan Cabañas, there are two hospitals, one in the provincial capital and one elsewhere. But during the pandemic, the hospital was only dealing with emergencies and had to deal with, in fact, all cases, including COVID cases. We've been able to, since then, create some primary healthcare facilities in the area, and some health promoters are now on the ground visiting the communities. But with the pandemic, a lot of that work had to be modified and adapted, and often slowed down or stopped. The health units, which are the frontline units for primary health care, are no longer dedicating themselves to dealing with the needs of the population. The hospital network was designed for other reasons as well. So there were a whole bunch of restrictions then that we saw as a result of COVID. And the health units were trying to do so many things at once in terms of monitoring, in terms of tracing, and then in terms of the social determinants of health, or in terms of issues relating to those who have some form of insurance. So there's a public system, but then there are certain specialties that are only offered in some units uh, for people who have insurance. But there were all kinds of appointments that were banned or seriously restricted, or you could access through the private system, but you couldn't access through the public system. Of course, not the whole population has access to the private system. And so it's a very complex scenario. But all of the restrictions and the economic situation in the country, a population with very low incomes who don't have private insurance, would not be able to access private services. That was already difficult at a time when the economy was growing, where people, were managing to get by, often in the precarious or informal sector, but at least they had some income. But it's that much worse now. Most women don't have the luxury to go to a private doctor. They just don't have the means. And the pandemic situation imposed even greater restrictions, because doctors who might have fees that are somewhat accessible, somewhat affordable, and whom you might be able to call and have a consultation over the phone, an appointment over the phone, through the public system. This became very complicated, very difficult to access. So just to get a basic checkup, there are 3 levels then. So there's the public system, the entire public system, the system for people who have some coverage through Social Security, and then there is the private system. We're going to take one last question and then we'll close, and we will continue afterwards with an informal discussion. So one last question is, what you both spoke about young people, about young girls and adolescents who have become pregnant. One of the questions that we received is, how are they treated in their home communities? These teenagers, who I imagine often are not married and who suddenly find themselves as mothers. How are they perceived? How are they treated? The reality is quite difficult for them. And there's even a register. The health ministry or the health system doesn't have any way to monitor how they're doing after they leave the system. This is a population that is at high risk, and so the situation is very complicated. For those who perpetrate violence. Often these are adults, adult men who are getting these young girls pregnant against their will. Often it is their aggressor, their attacker. We have girls who have become pregnant, who have COVID, who have no access to food, who have no proper health attention. We also have girls and teenagers who might face a spontaneous, sudden abortion in an unsafe situation. And because of their lack of good nutrition and so on, find themselves in a very weakened state. And these girls often find themselves condemned to 30, 40 years in prison, severe sentences, because they have been accused of accessing abortion services. We are creating networks in various municipalities to provide access to sexual and reproductive health care, to provide these services to isolated communities, but we need to normalize the fact that, yes, there are girls and teenagers in El Salvador who are pregnant. This needs to be seen as a normal thing and not blame her and see her as the cause of her own demise, that she deserves the way she's treated because she's brought this on herself. These attitudes need to be fought and need to be changed. Thank you very much, Marta Alicia. Thank you, Ada. We will conclude, and then those who want to stay can continue. Thank you to everyone for coming this evening. I hope that you learned a lot, as much as I did. These are frustrating and difficult situations to hear about. At the same time, the work that the Colectiva is doing is so inspiring, gives us hope for change here and elsewhere. So I'd like to thank Madame Gay for having joined us this evening.